And are we talking about different lasers to the ones that people have been typically using in clinic up until recently?
Yeah, there's a slide I could show you, which would give you a little bit of an inclination about this. So the people talk about hot or cold lasers, and really that's not a very good definition. We have to go to America for this, and there's an American National Standards Indexes that they use, and they define 4 different classes of lasers.
Right.
And the initial lasers were very weak, and
which is what we've got on this slide.
Yeah,
here,
this slide shows that when you're down in class 1, class 2 lasers, they're weak lasers, and although the wavelengths may penetrate deep enough, the power at depth isn't enough to create a biological change. Yeah. But as you go higher and higher in the thing...
Can we just get that slide up on the screen? Because I think it's useful just to see the different classifications. Yeah, it's up there now.
Absolutely. So, and to be able to go and by about the 1980s, there was class 3B lasers. Right. And class 3B lasers actually are very efficient, with the right wavelengths of penetrating deep enough. The problem is the time frame it takes. So they're very accurate at being able to go and stimulate tissues, but in order to go and get enough energy at depth for something like a back joint or a hip joint, it takes a little bit too long for most practitioners, especially chiropractors and osteopaths, where time is important, and also it's got to fit in with all the other manipulations and all the other techniques that they need to do within that clinic. Class 4 lasers have allowed us now to be able to fit in within busy clinics and multidisciplinary clinics a laser that allows you to do it within a short time frame, but actually using the right wavelengths, penetrate deep enough to be able to have a biological effect, both superficially and deep now.
How long have they been around in clinical use?
I think it's about 2002 was the earliest FDA and EU certification for class 4 as a therapy. They've been there before for surgical lasers, but in regards to safety, they only allowed them about 2002, and gradually the technology's progressed as well and improved since then.
And is the evidence behind this, how much of this is stuff that we ought to be sceptical about as being generated by the laser industry? And sometimes that's the only place that you're going to get evidence, I know. But
the majority of core science is done by non-commercial organizations, and that's great, because any decent medical equipment company will use these results. If I show you a slide a little bit further forward here, sorry. Most lasers, and this slide will help people understand, target things called chromophores. Yep. And it's the wavelengths and specific wavelengths that target chromophores. Okay.
Tell us about chromophores. That's a light receptive...
Exactly. In the world we know about green plants, and chlorophyll absorbing sunlight creates the sugars that creates all the green plants and all the biosynthesis that we know within the world. And that's sunlight energy that's doing that. In the case of our bodies, we know melanin. And obviously, if you have sunlight hitting your skin, it creates more melanin and you go darker. And it's a protective mechanism in your skin to prevent UV light damaging your skin. Okay. Yeah. There are other chromophores in our body, and these are the ones that we're really targeting, that allows us to biologically improve the efficiency of our bodies. And if you look on the slide here, which your members should be able to see now, there are 4 molecules that a good therapy laser should be targeting. In the skin, a red light can go and target melanin, and that's great, but it doesn't need to be powerful, because a powerful laser would actually burn the skin. But it's enough to go and heal wounds and scars and accelerate that process, and also reduce a little bit of the inflammation, maybe post-surgically or through damage. But the other 3 molecules there, the cytochrome C, hemoglobin, and water, they are targeted by infrared wavelengths and different infrared wavelengths, and they can penetrate quite deep into the body. Cytochrome C eventually would go all the way. If I used one of the 800 wavelengths that targets that, it would go through you eventually all the way through. So they can go quite deep. Right. But in targeting...
But without damage.
Without damage. But in doing that, we can go and improve the efficiency of cell metabolism. We can improve the oxygenation, even in an area that you may not be using. Say you've got epicondylitis and you're not using your elbow. Actually, you can improve the perfusion to that area and the oxygenation to it. And the water actually is the main medium that we use for blood. And therefore, in targeting that, we can actually open capillary beds in areas that the patient may not be actively perfusing as well as they could be.
Okay.